Good afternoon. My name is Jimena Ruiz Salcido. Today, reflection number 11, the crossroads of healthcare access, legal and increasing obstacles for irregulation migrants, for subject migration and health. What are the main points of the reading's documentary focus on concepts, ideas, and themes, not on individual facts? The central theme of the reading is the fundamental disparity between the human right to health and the reality of access to care for migrants, especially those in an irregular status. The universal rate is uniformly alternate the ring to the high hits attainable standard of physical and mental health is recognized for every person in international instruments like the Universal Declaration of Human Rights and the International Covenant on Economic, Social and Cultural Rings. This ring is often victim only between states and not directly enforceable by the migrants. Budget held as a migration control to many states, particularly in Europe, have adopted policies and laws that restriction non-emergency medical care for migration. This restriction is a deliberation political strategy that uses arguments of immigration control and protection or of resources for sustaining therapy, subordinating cheering to the health to migration policy. Obstacles to accessibility. The problem is manifestation in practice strong barriers that limit the principle of accessibility, which must be met in four key dimensions: economics, goals, physical location, or availability, informational lack of knowledge about rings or process, and crucially non-discrimination, fear of being reported or discriminations against due to status, public health consequences, irregular migrations and asylum seekers are a highest vulnerable group facing greater health risks and worse socioeconomic conditions. Poverty and destitution in the host country. This results in the poorer health status and a higher prevalence of infectious diseases like tuberculosis, TB, and HIV, which represents a public health risk for the entire society. Was anything unclear or confusing to you? Why? Um, what I found most confusing was the legal tension between no discrimination and migration control. International human rights law prohibits discrimination based on status, which so the logical protects immigrants. However, so Williams' article points out that states can argue that a discrimination based on immigration status is justified by the need for migration control. Even the main theory against racial discrimination is there explicitly allows discrimination as between citizens and non-citizens. It confuses me how fundamental um, fundamental principles of human rights, um, non-discrimination, can be legally everything or obedience be stated also the arguments of sovereignty and migration control. This relevance and interaction wakens integral and enforceable application of universal rings. What was new to you, and did it change how you think about or perceive things? Um, what was completely new to what to me was the realization the restriction or denial of healthcare to irregular migrants is in many cases an intentional toll of state police. I previously perceived the lack of healthcare access a problem of bureaucrats or insufficient resources for a non-contributing population. Now I understand that for governments it is a deterrent tactic to prevent people from migration. Full factor. Um, my perception changing upon understanding that this is not just an operation problem, but a hierarchy of values and policy priorities where border control and sovereignty are systematical placed above the fulfillment of an international ethical and legal obligation, such as the ring to health for every human being, was cherry anything you would like to explore further or learn more about. What I would like to thorough explore the cost benefits analysis in terms of public health and economic implications, be denying preventive services to migrants. The documents mention that restrictive policies are short system given that irregular migration have a higher prevalence of infectious diseases like TB, dengue, them early, relatively inexpressive diagnostics and treatments only ensures that cases progress to more severe states. States advanced cases are much more costly to treat, especially if there is drug resistance, and represent a greater risk of contagion for the general population in the host country. Um, I would like to research studies that quantify the economic cost and epidemiological risk regenerated by the denial of care in order to use a programming argument in addition to the human rights arguments to promote policies for universal access. giving at least one specific sampling of an aspect or experience in your personal, professional life related to the main topic shown in the documentary. A specific example from my professional experience relates directly to the obstacles of information accessibility and not discrimination for vulnerable population as detailed in the study on Nuevo León. When I came out as an assistant in the community services organization, my job was to help people appeal for social benefits, food, temporary housing, basic health insurance. I often encounter individuality while speeding help having the legal rings and necessary documentation for a service of denied themselves access. The obstacle was not the law but the information barrier. They didn't know how to start the process or what papers to bring, and in the institution first they had a deep fear of making good of being flagged by authorities or of having administrative staff. The team helped in the humiliating way. This experience taught me that no discrimination and informational accessibility are just as important as the law itself had or misinformation become a de facto genial of the ring even when the government or the law says the rings exist, which is a reflection of the reality faced by irregular migrations in the healthcare system. My name is Jimena Ruiz Salcido. I am finished. Thank you.